Focused stimulation is a naturalistic approach in which children are provided with a target stimuli during speech therapy sessions. The target stimuli is repeated multiple times throughout the session in a naturalistic conversation, such as structured play. This approach facilitates language development and production.
According to Pushpateeth and colleagues from 2017, this approach lays emphasis on techniques involving modeling and responsive interaction. The environmental arrangement and activities are organized in such a way that functional communication is taught to the child. This model assumes that language is learned and in a meaningful, interactive setup with conversational partners who promote vocabulary building of the child.
The name of my article is Efficacy of Focused Stimulation in Early Language Intervention Program for Toddlers with Repaired Cleft Palate. This article was found in the Global Journal of Otolaryngology. The purpose of the study was to determine if early speech and language intervention for young children with cleft lip and palate repair benefit from focused stimulation intervention and involving the mother of the child. There were two main objectives in the study that were listed in the article. The first one was to study the impact of intervention that is parent implemented on speech output for these toddlers with cleft lip and palate repair. And the second was to study the effect on early language intervention on particular linguistic parameters. This study included 6 toddlers that were all 2 to 3 years old. The qualifying conditions included an expressive language delay diagnosis and a cleft lip and palate repair. All of the toddlers spoke an Indian language called Kannada as their native language. The results in this article showed the importance of involving parents and the effectiveness of an early language intervention program using focused stimulation. In the article, there was a significant difference between the pre-test and post-test measures. The results indicated an improvement in the type and number of high, mid, and low frequency vowels. There was also an improvement of consonants and true words among all of the 6 toddlers. Also, there was a reduction in nonverbal behaviors in the participants post-therapy. There was a detailed pre-therapeutic assessment to receive a baseline. Then there was a total of 20 sessions conducted by a speech-language pathologist. The mothers of all the children were also active in these sessions. The target words were based off the most commonly used functional words by all of these toddlers. Post-therapy measurement was done after these 20 sessions to analyze the speech behaviors of all the children. All of the outcome measures from the therapy sessions and the baseline measures were placed into graphs in order to compare the data. To improve vocabulary, vowel, and consonant output, and to increase the number of meaningful utterances, an interactive play method was used in the study with children who had repaired cleft lip and palate. Overall, this study showed that focused stimulation for kids with cleft lip and palate repair was very beneficial.
The name of my article is Facilitating Vocabulary in Toddlers Using AAC, a preliminary study comparing focused stimulation and augmented input. The purpose of the study was to compare the language intervention techniques of focused stimulation and augmented input in children who use AAC devices. The study focused on 3 major questions. Would the intervention techniques result to improve expressive vocabulary in comparison with no treatment? Would differences with respect to rate of acquisition be observed between the 2 intervention techniques? And would differences with respect to acquisition, generalization, and maintenance be observed between the 2 intervention techniques? There were different qualifying conditions for the children compared to the adults. For the children in the study, they were between the ages of 2 and 3, and they had severe communication deficits, and their speech was less than 10% intelligible. And they used an AAC device with the use of gestures, facial expressions, and word approximations. Overall, their expressive language was consistent of 50 words or less, and they had mild to moderate or no cognitive delays. Their hearing and vision was within normal limits, and they were all from a monolingual English-speaking family. For the adults, there were 2 SLPs who were state licensed and American Speech Language Hearing Association certified, and they had a minimum of 5 years of experience working with children who use AAC devices. They provided therapy to the children in these studies previously. The other adults were special education teachers and another SLP who worked with the children previously. Overall, the study showed that both focused stimulation and augmented input have effective outputs in expanding expressive vocabulary in children beginning to use AAC devices. Because of the limited number of participants, it is hard to generalize the study across other populations. This preliminary study shows that focused stimulation and augmented input can be effective in increasing children who use AAC devices who otherwise had an extremely limited vocabulary expressive use.
Overall, both of these studies support the effectiveness of focused stimulation on children with expressive vocabulary delays and promotes language development. The goal is the client will produce at least one verb and one adjective during the session, provided a model and moderate verbal cueing.
To elicit focused stimulation during a speech therapy session, the clinician needs to have target words that they want the child to spontaneously produce. The targets that we are going to use are verbs and adjectives. The verbs are build and stack, and the adjectives are the colors of the blocks. It is important to follow the lead of the child. Here is our example.
We are basing our clinic example off of my journal article. I am the client, Abby is the speech-language pathologist. I'm a 3-year-old girl that has had a cleft lip and palate repair, and I also have a diagnosis of an expressive language delay. These items were picked off the child's interests.
Oh, look at the cars. So many toys. Look at all the toys. Oh, look at all the blocks. I have blue blocks.
Notice in this example how Abby is constantly prompting Anna, the client, to produce the word stack and the color of the blocks.
Look at me stacking all the blocks. Look at this green block. Oh, I'm going to put the red block on the yellow block. I love building blocks. Stack the red block on the blue block. The yellow block goes on the orange block. I love stacking all the blocks.
Stack red.
You stack the red block on the blue block. Good job.
This is the data that was collected. The client spontaneously produced stack and red, which were both target words. Focused stimulation is mainly used with young children with severe expressive language delays. Because these children have these severe expressive language delays, it is an achievement for them to say at least one word in a session. It is important to pick items that the child is interested in and is in a naturalistic environment because it will make them more interested and more likely to say the target word. In our example, the child loves to play with blocks, and that is why the clinician, Abby, chose to incorporate blocks into the session.
In an ideal 30-minute therapy session, this focused stimulation would be implemented throughout the entire session. The ideal goal is to have the child spontaneously produce the target words.
Remember to choose a naturalistic environment. We chose a play session. Choose objects that the client is interested in. We chose blocks, cars, and animals. Choose activities to incorporate the target words.